Most of us know our blood pressure or our cholesterol numbers, but there's a hidden metric measured during every standard heart ultrasound that acts like a biological clock for your cardiovascular system. It's called the E to A ratio. It sounds technical, but it's actually quite simple. It measures how blood flows into your heart's main pumping chamber. And strangely enough, this ratio can tell a doctor exactly how old your heart actually is, regardless of the date of your health certificate. Think of your heart like a sponge. To work well, it doesn't just need to squeeze, it needs to be soft enough to spring back open and fill with blood. Now, when your heart relaxes, there are two phases of filling. The first is a passive rush, the E wave. In the young, flexible heart, that E wave is huge because the heart snaps open like a brand new spring. The second phase is a little kick from your atrium, the A wave, to finish the job. Now, in a young heart, the E is much bigger than the A wave. But as we age, or if we have high blood pressure or other heart disease, the heart muscles start to stiffen. It becomes like an old dried out sponge. The initial snap, it kind of disappears and the E wave shrinks. And the heart has to rely more on the active A kick to get the blood in. Now that ratio flips, it's a sign that your heart is biologically aging. But there's some good news. Heart aging isn't really a one-way street for many. Unlike the wrinkles on our skin, the stiffness of our heart muscle can be reversed in some. Research has shown that consistent aerobic exercise, things like brisk walking, cycling, or swimming, acts like a stretching routine for the inside of your heart. So when you exercise, you force your heart to handle more blood volume, and over time, this training can actually reduce that stiffness of the muscle fibers, returning it the E to A ratio to like this. Now, we've seen cases where people in their 50s and 60s, through dedicated aerobic training, have improved that E to A ratio back to normal levels. Now, you're quite literally de-aging your heart. The takeaway. So the next time you hear a doctor mention your echo results, ask them about their E to A ratio. They may not even mention it to you. It is a powerful window into your heart's flexibility. A stiff heart is an aging heart, but a heart in motion stays young. You have the power to change your ratio one workout at a time. Your heart is a muscle, and with the right care, it can stay young for a lifetime.